Did you know that over 47 million people in the United States have chronic kidney disease, and many are even unaware of their condition? Interestingly, about 40% of these patients are diabetic, meaning that even a small change in their body can be a warning sign. Your skin may be one of the first warning signs, something most people overlook, thinking it's just dryness or normal wrinkles. In this video, you will see 9 vital skin signs that could save your life or the lives of your loved ones. And one of them is so common that it might be on your skin right now, and you haven't even noticed it. 1. Severe dry skin, cirrhosis. Dry skin in kidney diseases is more than just simple dehydration. The skin may become rough and scaly and may crack, increasing the risk of infection and pain. Between 50 to 75% of dialysis patients experience this issue, which can even lead to severe itching. The kidneys are responsible for eliminating toxins, regulating minerals, and controlling the balance of water and electrolytes. When kidney function decreases, blood phosphorus levels rise, and the skin can no longer maintain its moisture and natural oils. Additionally, deficiencies in vitamins and minerals such as zinc and B vitamins, which are indirectly managed by the kidneys, can weaken skin repair and health. Using moisturizers, taking short baths with lukewarm water, and following a proper diet and supplements can help reduce dry skin, but monitoring kidney status and mineral levels is essential. 2. Swelling, edema. Swelling or edema is one of the most obvious signs of kidney dysfunction. It initially appears in the legs, ankles, and face, with the skin in these areas becoming shiny, stretched, and tight. In severe cases, especially in nephrotic syndrome, a large amount of protein is lost from the body, leading to widespread swelling. The kidneys are responsible for eliminating excess water and salt, as well as regulating blood pressure and blood volume. When their function decreases, sodium and water accumulate in the body, causing swelling. Additionally, the loss of protein through urine reduces the osmotic pressure of the blood, allowing fluids to seep into body tissues, which exacerbates the swelling. Statistics: swelling typically begins in stage 3 of chronic kidney disease, CKD stage 3, and worsens as the disease progresses. Take persistent swelling seriously and check blood pressure, protein levels, and kidney function. Treatment may include diuretic medications, a low-salt diet, and management of underlying conditions. 3. Rashes and skin spots. Kidney diseases can cause itchy rashes and skin spots that indicate the accumulation of toxins in the blood. These rashes are usually small, round, and bumpy, and they may be accompanied by thick patches and changes in skin color. The kidneys eliminate metabolic toxins and urea from the blood. When the kidneys fail, these toxins accumulate in the blood and skin, triggering inflammation and itching by irritating the immune system and skin nerves. This condition typically occurs in the advanced stages of kidney disease and indicates the body's inability to eliminate waste. Statistics: this type of rash and itching is very common in patients with advanced chronic kidney disease, CKD, and dialysis patients, and it can increase the risk of infection due to immune system disruption. To reduce skin damage, avoid severe scratching, use anti-itch creams, and ensure timely dialysis to control blood toxin levels. 4. Calcium deposits and calciphylaxis. In kidney diseases, the balance of body minerals is disrupted, and calcium deposits can form in the skin and blood vessels. Most deposits are harmless, but calciphylaxis is an emergency condition that leads to painful and non-healing wounds, which can threaten the patient's life. How the kidneys function. The kidneys regulate calcium and phosphorus and produce active vitamin D, which is essential for bone and skin health. When the kidneys do not function properly, blood calcium and phosphorus levels rise, leading to the formation of calcium deposits in blood vessels and tissues. These deposits cause vessel blockage, reduced blood flow, and skin tissue death. Calciphylaxis occurs in 10% of dialysis patients and sometimes after kidney transplantation, associated with a high risk of death from infection or organ failure. Rapid diagnosis and emergency treatment, which includes lowering calcium and phosphorus levels, specific medications, and careful wound care, can save the patient's life. 5. Uremic frost. Uremic frost is one of the most severe signs of kidney failure. Urea crystals appear on the skin as a white or yellow coating, often on the forehead, hands, neck, and trunk. The skin is dry, scaly, and has a distinct ammonia odor, indicating an urgent need for dialysis. The kidneys eliminate urea and other nitrogenous waste from the blood. When the kidneys fail, blood urea levels rise and are excreted through the sweat glands. As sweat evaporates, urea crystallizes on the skin, resulting in this characteristic coating. Statistics: uremic frost occurs when blood urea nitrogen, BUN, levels exceed 200 mg per deciliter, and it has become rare in developed countries due to access to dialysis. Uremic frost is an emergency condition requiring immediate treatment with dialysis to prevent death or severe kidney damage. 6. Severe itching without rash, pruritus/uremic pruritus. Severe itching is one of the most bothersome and common symptoms in patients with chronic kidney disease. This itching usually appears without any noticeable rash or redness and can worsen at night, to the point of disrupting sleep and forcing patients to scratch continuously. Frequent scratching can lead to open wounds, bleeding, and an increased risk of infection. The kidneys are responsible for eliminating waste products such as urea and metabolic toxins. When their function declines, these toxins accumulate in the blood and stimulate the skin's nerves. Additionally, mineral balance is disrupted, leading to systemic inflammation, which explains the severe and persistent itching. Approximately 90% of dialysis patients experience this itching, making it the most common nonspecific symptom of chronic kidney disease. Treating this itching is often not straightforward, and antihistamines are typically ineffective. Methods to reduce blood toxins, such as regular dialysis, using strong moisturizers, and managing phosphorus and calcium levels can help. 7. Skin discoloration. Skin discoloration is another important symptom of kidney disease that is often easily overlooked. The skin may appear pale, pallor, or develop mild to moderate jaundice, and in some areas, such as the lower legs and backs of the hands, darkening or hyperpigmentation may be visible. The kidneys play a crucial role in producing erythropoietin, which stimulates the production of red blood cells. A deficiency of this hormone leads to anemia and pallor. Additionally, the kidneys are responsible for eliminating urea and keratin. When their function declines, these substances accumulate in the skin, causing jaundice and darkening. Statistics: anemia and pallor are observed in about 20% of patients with stage 3 chronic kidney disease, CKD, and 90% of dialysis patients. Early diagnosis of anemia and treatment with erythropoietin and iron supplements can improve skin color and increase the patient's energy levels. 8. Blisters and rare skin diseases, blisters/porphyria cutanea tarda/linear IgA dermatosis. Blisters and rare skin diseases in kidney patients can be painful and severe. Porphyria cutanea tarda, PCT, causes fragile blisters on sun-exposed areas such as the hands and face. These blisters may rupture, dry out, and leave scars or marks. Additionally, linear IgA dermatosis is a common autoimmune disorder in end-stage chronic kidney disease, CKD, patients that leads to small, scattered blisters and has a high risk of infection. The kidneys eliminate metabolic waste and enzymes related to porphyrins. When the kidneys cannot effectively remove these substances, porphyrin deposits and other metabolites damage the skin. The immune system may also become hyperactive under these conditions, resulting in autoimmune reactions such as linear IgA dermatosis. Statistics: these diseases are common in dialysis patients and those with advanced CKD, and without appropriate treatment, they can lead to infections and permanent skin damage. Careful skin management, avoiding direct sunlight, using protective creams, and receiving medical treatment under the supervision of a nephrologist or dermatologist to control infection and inflammation is essential. 9. Nail and hair changes. Kidney disease can cause specific changes in the nails and hair that are often overlooked. The most common nail change is half-and-half nails or Lindsay's nails, where the top of the nail is white and the bottom is pink or brown. There may also be transverse white lines on the nails, Muir's lines, that indicate protein deficiency or hypoalbuminemia. In hair, thinning, brittleness, and severe hair loss are common. The kidneys play a direct role in nail and hair health by regulating the balance of minerals, proteins, and hormones such as erythropoietin. When kidney function declines, protein deficiency and disturbances in mineral and hormone absorption lead to changes in color, brittleness, and hair and nail loss. Approximately 20% to 50% of chronic kidney patients experience nail changes, and in dialysis patients, up to 84% with anemia exhibit this sign. Paying attention to the condition of nails and hair can be an early indicator of kidney problems, and medical evaluations for blood protein levels and kidney function are recommended. Remember, your skin speaks, and it may convey vital messages about your kidneys. Ignoring these symptoms can have serious consequences, especially if you have diabetes or high blood pressure. If you notice any of these skin changes, even minor ones, consult a nephrologist and take regular kidney checkups seriously. Remember, early diagnosis can save your life, and with simple measures, you can maintain your kidney health. Your skin not only reflects your beauty but can also be a key indicator of your health.